Hi, good afternoon, good morning, wherever you are. I'm Russell Roybal, Chief Advancement Officer at San Francisco AIDS Foundation, and I want to welcome you to this edition of TogetheRide In Conversation, Sexual Health Testing and HIV. I will be your hostess this afternoon as we have a great conversation with two experts from our two supporting agencies, the San Francisco AIDS Foundation and the Los Angeles LGBT Center. I want to remind you that if you would like closed captioning of today's show, you can scan the QR code in the top corner of the screen or check out the chat for the link. And as always, we love your questions. So if you have questions, you just go ahead and put them in the chat or comment section of Twitch or Facebook Live, wherever you're viewing, and we will try to get to as many of your questions as possible closer to the end of the show. So again, welcome, happy May, and let's get started. So I want to introduce our first panelist, Jorge Roman. Jorge oversees the clinical services at Magnet, which is the sexual health clinic at San Francisco AIDS Foundation. Jorge is passionate about healthcare delivery for clients living with HIV and HIV PrEP. Jorge came to SFAF in 2019. Prior to that, he worked at Ole Health, where he led efforts for LGBT inclusion and culturally appropriate care. Jorge holds a Bachelor of Science from the University of California, San Diego, and a BS and Master of Science from the University of Pennsylvania School of Nursing. Welcome, Jorge. And our second panelist is Hope Hatem. Hope, sorry, in the pre-show, I did not ask you the correct pronunciation of your name, so please correct me if I did not pronounce it correctly. Hope has a bachelor's degree in psychology from the University of California, Berkeley. She's a former U.S. Marine and has over 6 years of counseling and outreach working experience in both Los Angeles and San Bernardino County. Having previously worked at a sexual assault crisis center in LA, she joined the Los Angeles LGBT Center in 2019, where she currently works as the outreach coordinator for the community health programs. So welcome, Jorge and Hope. Hi.
And you pronounced my name absolutely perfectly, so thank you so much.
Oh, great, great. I was a little worried. Well, I don't want to get on the bad side of a former U.S. Marine. So welcome. I'm so excited for us to have this conversation today and to be able to answer folks' questions. So let's jump right into it. And the first thing, Jorge, let's start by talking about what role sexual health testing plays today at San Francisco AIDS Foundation in ending the AIDS epidemic.
Yeah, thanks, Russell. You know, historically, seeking sexual health services has largely been stigmatized, particularly for the LGBT community. This is an especially salient point for queer, Black, and brown people, where there has been an inherent distrust that has developed with the healthcare delivery in this country. You know, I think the idea of testing routinely for STIs has not really been considered mainstream or even acceptable. I think even the idea of sexual health, the term sexual health, is new in general, and understanding the importance of how our sex lives and our practices influence our health and how important sex is in general. We are sexual beings, and this importance is really a new concept. And so places like Strut and the LA LGBT Center are newer ideas born from the growing understanding and needs of our communities. STI testing is really the first step towards HIV testing and really offers that first glance, opens the door and engages our clients and our patients, educating them and helping them understand their potential risk for HIV. It really is also a great stepping stone and beginning discussion to things like PrEP, HIV pre-exposure prophylaxis. So supporting efforts that we have at Strut and the San Francisco AIDS Foundation really is supporting the fight against stigma, which really is what gets in the way of us achieving our goals.
Well, I think that's so true, Jorge. I was with a group of friends over the weekend celebrating a friend's significant birthday. We're all vaccinated, and we started to have a conversation about sex and sexual practices, and people got very uncomfortable. And I was so surprised. I mean, I feel a little bit privileged because I work at San Francisco AIDS Foundation. I get to engage in these conversations all the time. But I was a little taken aback that folks who I have spent a lot of time with, who I'm very close to, could not engage in a conversation about sex or behavior, or even though I know it's so much a part of our lives. And it really surprised me that this group of friends that I was with couldn't. It was almost like giggly, like like there, and not wanting to talk about it, like almost being embarrassed about it. So I think that what you're saying is totally on point, because it's something we all need to talk about more. Hope, what about the work at the LA LGBT Center?
Yes. So yeah, thank you for the question. I absolutely agree with what you guys are all saying. Definitely something that is still trying to become the normal part of conversation within our communities. With us, considering that Los Angeles only makes up about 25% of the population in the state of California, Los Angeles actually has up to 35% of new cases for HIV, at least in 2019. And according to the CDC, if current HIV diagnosis persists without intervention, 1 in 2 Black men who have sex with men will become HIV positive in their lifetime. And for Latinos, that number is 1 in 4. So we know for sure here in Los Angeles, we still have a significant role to play for us to get to 0. So here at the center, HIV positives per year have continued to drop significantly in recent years, which may be linked to an increase in stuff like PrEP in Los Angeles. Studies have actually found that significant reductions in new HIV infections in in cities where PrEP has become more prevalent in Los Angeles County. And we think that the main avenue for PrEP is through testing. HIV testing has been sort of like the foot in the door to the community to provide more services like PrEP, and even provide a safe space for people to be able to address sexual health issues they might not be getting elsewhere, which that can lead to becoming more involved in their own sexual health. And any individual who tests positive for HIV can actually get immediately linked to care, thereby reducing the spread of HIV and preventing HIV from progressing to AIDS. Furthermore, here at the center, when people come in to get tested, it allows us the opportunity to potentially connect with even their community, the community members' social network, like their friends, their partners, and their family. And that actually further broadens our reach for sexual health education, which we feel is an essential part to getting us closer to ending this AIDS epidemic.
Hope, both you and Jorge talked about PrEP, and I'm wondering, in your view, how has sexual health testing, messaging, and practice changed with the expansion of things like PrEP and PEP?
Yeah, so PrEP has been a huge contributing factor to helping us get better acquainted with our sexual health in general. It's so interesting that at the beginning of the AIDS epidemic, messaging around HIV and AIDS had a more fear-based approach to treatment and care, where fear-based messaging seek to kind of like scare the health into people by emphasizing terrible things will happen to them if they don't behave in recommended ways. But we know that these messages often had the opposite effects by making people helpless and paralyzed by the lack of hope, and only resulting in creating stigma and shame around the issues. Moreover, policies that focus solely on preventing negative behaviors are ineffectual in many cases and have negative consequences. But of course, then there was PrEP. PrEP and PrEP, or pre-exposure prophylaxis and post-exposure prophylaxis, respectively, have impacted sex, pleasure, intimacy, communication, and sexual behavior in a big way in our communities since its inception. Since the onset of PrEP, with continued innovation and with the continued innovations of HIV treatment, the focus on sexual health testing, messaging, and practices has changed to encourage community pride, self-efficacy, empowerment, and knowledge. With this approach, it includes things like sex positive and affirming attitudes, which encourages self-acceptance, self-agency, and self-care, where the goal is to promote the positive actions that clients can take to maintain and improve their health. Rather than stigmatizing sex as being dangerous or pathological, this approach promotes sex as positive while still understanding risk and taking precautions to prevent disease by utilizing prevention tools like PrEP and PEP, condom and HIV testing and treatment services. By encouraging people in achievements and focusing on what people have to contribute generates increased confidence and psychological well-being, because we know we're not treating just HIV, but we're treating everything that comes along with it. Clients often tell us how prior to starting PrEP, all they felt was fear and anxiety and shame around sex. We believe that utilizing prevention tools like PrEP actually empowers people to take control of their sexual health and well-being, and actually helps normalize the conversation around sex, which helps bring down the stigma that surrounds it. It used to be that HIV positive people were put in a place where they were only having sex with other positive people, which is known as serial sorting. But because of key HIV prevention strategies like treatment as prevention and PrEP and PEP, they now find themselves liberated to have sex with anyone that they choose to, and have the kind of sex that they actually enjoy.
Well, that's great, Hope. We do tours at SFAF, and when I lead the tours, I tell a story of how when I started having sex, I'm going to be 50 this year, and I started having sex in 1989 when I was 17 years old, sex with other male identified folks. And I just remember, I can't remember a time until I started on PrEP that I didn't think I was going to die with every intimate act. Like, that I was taking my life in my hands, because those were the prevention messages, right? That were around back then, like you said, like scaring the health into people. And I remember when I started on PrEP, it just, that melted away. And that I finally, I think, although, I think sex has always been pleasurable, like I did think about that. And, and all of those messages, I think I did not get to experience the full joy of what it meant to be queer and having queer sex, because that was in the back of my mind all the time, that something bad was going to happen as a result of my behavior. So I think that's such important things for our audience to hear. Jorge, let's talk a little bit about the barriers, because there are still a lot of barriers that exist to sexual health and HIV testing today. How is San Francisco AIDS Foundation addressing those barriers in its work?
Yeah, thanks, Russell. I think one of the biggest barriers is that there aren't more places like Strut and the LA LGBT Center that exist all over the world for LGBT individuals specifically, especially diverse communities. Places that really seek to empower individuals, reduce stigma, and allow people to get and seek the services and care that they need. We have clients from all over the state, all over the country, all over the world that come and seek services at Strut specifically because of our sex positivity. Really, like, they've not encountered a place like this that really focuses and centers their priorities and their needs. We really focus on centering sexual health and sex lives, really making it the focal point and delivering that care to the individual. Another huge barrier to that, and in concert with that, and particularly for queer, Black, and Brown individuals who are already less likely to access stable healthcare. In some cases, this is the way that people engage in healthcare at all. And there's just an inherent distrust to traditional healthcare settings. People have experienced racism with the current healthcare system and true violence at times. And so I think those barriers, those are the key points, the key aspects that we're trying to eliminate and reduce when people are walking into our door. Talking a little bit about PrEP, the uptake amount amongst queer, Black, and brown individuals is still not where we would really want it to be able to really impact where the highest rates of HIV cases are. And so that's really the work that we're trying to work against here at the San Francisco AIDS Foundation. We promote health, wellness, and social justice for communities most impacted by HIV through sexual health and substance use services, advocacy, community partnerships. We're really looking to reduce the stigma in all ways. One of those ways, and the biggest ways, is we're trying to ensure that our staff in particular are reflective of the community. So we want our clients to be able to see themselves in the front desk individuals that they first encounter when they walk in the door, with the lab technicians that they see who are taking their labs, who are taking their samples, all the way to the back with the clinicians, with our nurses and nurse practitioners. Really want our clients to see themselves in those individuals and be able to connect with them. Things like eliminating barriers like insurance, immigration status, just eliminating that as even a factor that plays into the ability to be able to access services. Substance use isn't an issue. Housing status is not an issue. And we really look to ensure that people can obtain services in the languages that they prefer. So really it's a large, many barriers, but we're really looking to eliminate and minimize those barriers in every way we can, really centering the client and meeting them where they're at.
That is awesome. And what is the experience the same at the center, Hope?
Absolutely. I absolutely agree with the fact that meeting them where they're at has been such a great great move for us to make, just because of the fact that we understand that it can be kind of hard to go to cities that you're unfamiliar with, or places that you feel like you might not be accepted or anything like that, you know. So we actually had one of our most recent clinic openings in both the South LA and Boyle Heights area, which are predominantly areas that that have Black and brown people. We've even began like offering health cares in venues that provide community services, and we try to attract people that might shun off like a clinic. So we offer offer services at like places like a house and ball event, or celebrations of like places like things like Cinco de Mayo or something like that, where we try to be there for them, so that way they don't have to specifically go into a clinic. And you know, a lot of the times people feel like they go into clinics and like there's something wrong or something like that. We've heard a lot of that medical mistrust of situations like that. On top of that, the center tries to offer a very friendly and welcoming environment. We know that there's been so many barriers that are associated to like poverty and race and lack of access to healthcare. Even LGBT status can kind of prevent people from wanting to kind of go out there and like basically come out based on their medication alone, right? Like we've all heard people call like PrEP as like the gay pill or something like that. And that can be stigmatizing for some people. And sometimes people can avoid getting that kind of treatment just because of the stigma alone. We also have known, we've talked to our community that there are some people who don't come into to get care, not because they're afraid of the results or they want to get the results, but only because they have a fear of just getting poked. They don't want to get blood drawn or something like that. So we've been actually trying to incentivize them by offering gift cards and stuff like that, just to come in and get tested regularly. And that's actually been a very big help for us to kind of engage our community more and kind of get that foot in the door, you know, because as soon as we kind of get them to test, then we can start the conversation with them and then kind of get them in a regular regimen of treatment. One other big thing that I've heard recently, and it's something that we've been trying to be very proactive with, is that our language is outdated. We have to sometimes speak in their language. Oftentimes, we stick to appropriate language, and that can push away like youth to kind of engage their sexual health and stuff like that. So sometimes we just have to kind of bite the bullet and just kind of speak in their language to spark attraction in them. And we've, taken heed of that, and we've kind of tried having out campaigns with things like Slay Me Safely, or Fearless Fucker, or Prep AF, excuse my language, by the way. And we are actually even trying to further involve like our youth ambassadors to help us kind of come up with future campaigns and messaging, because we know how important it is for them to be able to connect with the messages that we're actually providing. It's not always that we have to stay professional in that sense, because we know that that's what's going to rope them in and get them into the door. So we think that's something that we, and the thing is too, a lot of our promotions and campaigns, none of them are copyrighted. And we love to put that out there because we want other organizations to take it and ride with it, or put it on their t-shirts and spread it, because we know that it's important for us to be sharing this information and communicating with other organizations.
I love the Fearless Fucker campaign. I actually have one of those shirts. I wear it often.
Yeah.
Because and I remember the signs on the street that people in West Hollywood complained about, but it totally raised awareness because people had to face it in that moment. And I think that work is so important. And the other thing I wanted to say was I was talking to I met a doctor a few weeks ago who was talking about, who's become more involved in our organization, and said that in their practice, they're a dermatologist, but in their practice, they came to Magnet at San Francisco AIDS Foundation, and they felt so welcomed in that space that they tried to emulate that in their own practice here in San Francisco, so that people feel like they're seen, that it's language they understand. And so I thought that was like an ultimate compliment for my colleagues at our clinic at STRA at Magnet, because everyone should feel that way when they walk into a clinician or provider's office. So let's shift gears a little bit and talk a little bit about what we were talking about before, which was around new HIV diagnoses. And while overall new HIV diagnoses have declined, new HIV diagnoses in Black and Brown and trans communities in particular still remain very high. And what role, Jorge, does testing have to play in addressing these ongoing disparities?
Yeah, Russell, let me just begin by just stating the fact racism is a public health issue. And being Black, brown, or trans isn't the risk factor. It's the fact that because of structural racism, these communities have had lack of access to really quality healthcare that really centers them, their priorities and their needs. These communities have really not been able to access and have not had the ability to access sexual health services, particularly sexual health services that are sensitive to their needs and that message to their needs. And truthfully, as I mentioned earlier, Black, brown, and trans individuals really have just felt violence, just a strong level of violence from the medical system. This has really resulted in a level of distrust that's been placed between these communities of color and the current healthcare system. I mean, why would you want to engage in care, step into the door of a healthcare system if all you're experiencing is distrust, if you don't trust these individuals, and frankly, just violence at the hands of those that are there to actually help you? Health justice is social justice, and that's what we understand at the San Francisco AIDS Foundation. We work through this by centering Black, Indigenous, and all people of color and gender nonconforming and transgender individuals at the clinic. One of the primary ways we do that is we seek to reflect that in our staffing. As I mentioned earlier, we really look to ensure that the clients that we are looking to center and bring into the clinic can see themselves in the people who are there and they're trusting for their care. All of our educational materials are really focused on trying to center BIPOC individuals and trans individuals. We provide services in all languages and try and ensure that what we're doing is being sensitive to the needs of the individual who is coming in front of us. Other ways that we're engaging, we're actually partnering with the Oakland LGBT Center to really try and bring testing services to an area, a community here in the Bay Area that has historically been lacking. There's just a dearth of sexual health testing in the East Bay, and we're really looking to support the Oakland LGBT Center. So a little shout out to them for their efforts to really bring testing and HIV prevention to their community. You know, I recognize this isn't going to remedy the whole system, but it really is a way to engage with our communities, particularly those that historically have been left out.
Thank you for that. And I want to remind folks, if you have questions, please put them in the chat on Twitch or on Facebook Live, and we'll be getting to those questions in just a few minutes. Hope, news reports over the last month have indicated that 2020 was a record-setting year for sexually transmitted infections nationwide. How has the center been responding to that?
Oh my gosh, 2020, that was a year. We've all been kind of still recovering from that and everything. And yes, we see a lot of things going on with, you know, with the kind of opening up of well, it's not really completely opening up, but we're kind of getting to like a sense of normalcy now, slowly. And with that comes in kind of like this wave of things that have been kind of held off since the pandemic started. We have been trying to study this phenomenon closely, trying to figure out what this sudden spike actually meant. What is it? We have a number of theories of why each one can be that are kind of related to COVID. So one theory is that people could probably have contracted STI during the beginning stages of the pandemic. And although you get sometimes with some STIs like syphilis, you might get like some symptoms that persist, but then soon after they kind of inoculate. And then from there, inoculate meaning like, you know, it tends to kind of like not show any more symptoms. And then soon after, they see those symptoms kind of go away, and kind of shrugging it off as kind of like just a cold sore. And then they begin engaging again, and then they start to spread and re-engage with that. So we think that might have been one of the issues. Definitely for us, we've been ever since we've kind of been seeing the spike, we've been trying to respond to that by making sure that we're not turning people away, because during the pandemic, we weren't actually taking any walk-ins. And that's kind of still true now. But now that we see that it's a necessity that we need to start taking in, we have people kind of call for an appointment while they're at the door. And if we have any openings from any cancelizations, then we kind of take like an immediate availability appointment. So that way we don't have to turn people away, because a lot of the times some of these situations that people can be in can be like immediate assistance that they need, or kind of like something that's been on their mind for a little while and they're trying to get it out of the way now. Another theory is that when the pandemic hit, we are kind of a provider for condoms and lube across the city for West Hollywood and Los Angeles. And we noticed that a lot of the bars and the clubs were kind of closing down, and they weren't taking our condoms anymore because they didn't have any traffic. And that actually caused a lot of people to not have access to like their normal access point for free condoms that they would normally be able to pick up. And that lack of condoms and lube availability actually may have caused them to kind of become, you know, a little bit less, take more risky sex because of the fact that it's not there. I mean, the stigma's still there when people try to go buy condoms, you know, not only the price, but also just going there, you know, kind of people still feeling like they don't want to expose to like the clerk or something that they're buying condoms or something like that, you know, especially like price checks or something, who knows. But the overall idea we've been trying to kind of get to is trying to re-engage our partners that are out there to see how much, you know, if they need any condoms, like Studs Theater, which is in West Hollywood. It's a place that's very prominent for people to go in for the LGBT community. And they just recently opened, and as soon as they opened, they noticed that they had a huge demand for condoms. We actually had to hand them like about 4,000 condoms, and the following month they they wanted to kind of get resupplied. So just understanding that lets us know that maybe people have been engaging people with condomless sex. We've actually been even getting sex workers coming up to our door saying that they don't have any other place to go get condoms, and we would actually give them just in a total abundance. I think though, one big note for the response that we've had has been social media. We've been able to still provide like any avenue of education, as well as getting people connected to care. On top of that, we also been running still like multiple campaigns, such as like Stress Less Sex, Get Some, Get Tested, and we kind of promote these not only on our social media sites, but throughout our clinics as well. And they just run on our TV screens, making sure that we also get that information out, as well as wild postings, which are basically paid postings that we have all around the city to in places specifically that are around our clinics, so that way people can kind of have that awareness availability for them. So those are some of our theories and some of our responses that we've had for that. So.
Well, thank you, Hope. And what about SFAF, Jorge?
Yeah, I'm just going to start off by echoing what Hope said about what a year 2020 was, from a variety of perspectives, not just the pandemic, but fires, the social, racial reckoning here. A lot of stuff has been thrown at us. And what I can tell you is that people have definitely continued to have sex through the pandemic. They just have not been able to access services in the same way that they've been able to engage in services. Even, private health doctors, big health systems were not really prioritizing or centering sexual health as part of really prioritized healthcare needs. And so places like LA LGBT Center and Strut were some of the few places, and probably the largest healthcare delivery of sexual health services in the area. And, you may know, Russell, for those of you in our audience, may or may not know that the San Francisco AIDS Foundation was formed in response to a health crisis. And so we know how to show up for the community. And that, for us, that meant remaining open. And so I'm really proud to say that at Magnet here at Strut, we stayed open through this. Now, of course, our services were greatly reduced at the beginning, but we prioritized the things like PrEP and PEP. So anybody who ever needed to access those services since the beginning of all the shelter-in-place orders were always able to access those services. We're able to initiate PrEP, and we're able to initiate PEP. The other thing that we prioritize is syphilis in specific when it comes to STIs. So yes, it's been record-setting for STIs nationwide, and there's been particularly a lot of attention put on the amount of syphilis cases, particularly neurosyphilis cases and congenital syphilis that has been out there. And we know this. Again, this is our expertise. We do this every day, and so we did not put any barriers to people accessing any kind of care when it came to syphilis, because we wanted to ensure that we were offering that to anybody. So as I mentioned, we really prioritize and centered STI testing because we understand and recognize that sexual health is as important as a routine health screen. Kind of another plug for us is we started offering COVID vaccines. So in early February, we started vaccinating the community. And part of the reason we got into the vaccination game is because we know that LGBT individuals are less likely to be connected to traditional healthcare models. And so we wanted to ensure that we had a way to be able to connect individuals to the vaccine, because we knew that it was very important for all of us to be able to get back close together, celebrate Pride, celebrate Folsom, all those festivals that we love to get together with each other. The way to do that is to get people vaccinated and to ensure the health of the community overall. And so I would just say that I'm just really happy that we've are almost back to pre-pandemic levels when it comes to testing. The amount of people that are coming through here, we are popping again, really busy. Our PrEP enrollment numbers are up from the previous months and up from the last year. So I'm really excited to see that people are re-engaging in the care.
Well, that is totally awesome that both the center and the foundation have continued to provide those services throughout the pandemic. And I mean, I can't wait for festival season here in San Francisco. I have like two years of outfits saved up, ready to put on. I was so excited when Folsom Street Events said they were going to do Folsom for sure. So or that they're planning for it. So I think but what both of you talked about is so important to underscore that the sexual health is as important as other health-related matters, and that in both of our communities, really the center and the foundation were some of the only service providers that were focused on that throughout the pandemic and never stopped serving our client base, because in both of our organizations, our clients sometimes don't have other places to go. And so being there for them and staying open was really, really important for the health of our community. So as we anticipate like vaccinations coming, more vaccinations, the rollback of shelter in place, the governor has announced that the state is supposed to open up in June, the new mask guidance from the CDC. And we talked a little bit about this already around like what the community needs to do or needs to know about staying healthy. And both of you have already talked about that. Really, people did not stop having sex during the pandemic. It just might have been there a little bit of a behavior change and access to information and supplies. But I really want to focus on what are the services that folks can access at both of our organizations. Because if you're watching this and you're doing TogetheRide, this is the money that you're raising through TogetheRide, or if you participate in AIDS Life Cycle and AIDS Life Cycle returns, that this is what your resources that you raise go to fund, so that folks have access to quality care at the Los Angeles LGBT Center, at the San Francisco AIDS Foundation. At the foundation, all of our services are free of charge. I know that anyone can go to the LA Center too, regardless of whether or not you have insurance, because they're a federally qualified health center. But what are the services? Can we do like a quick rundown for each around what is available and what folks can access? Because I think a lot of people had some misconceptions that during the pandemic, they couldn't go, right? Or that so as Jorge, you said, things were starting to come back. So what can folks access at San Francisco AIDS Foundation?
Yeah, thanks, Russell. So first, I'm just going to say, please come back, re-engage in care. That's really the point I want to get across. So I would start off by the main topic of discussion today, STI testing. So we offer full scope STI testing, and I would say that's one of our bread and butter. That's what we offer most of all. We offer PrEP appointments, so people who are newly looking to initiate HIV pre-exposure prophylaxis. Also post-exposure prophylaxis for those who are not on PrEP, or maybe those who were on PrEP and got off PrEP for a short period of time and need some help to reduce their HIV transmission risk. Hep C screening and treatment we also provide, and we do that at both here at our main location and our our syringe access site at the Harm Reduction Center on 6th Street. And so we continue to provide those services in addition to the access to syringe supplies. We also offer support to those seeking substance use services. As part of the care, we're starting to re-engage with clients and bring people back in for those services. We also offer transgender affirming care. So we want to make sure that, and that's also something that we had prioritized through the pandemic and continue to prioritize to make sure that people get the care that they can't often get in other places. We are starting to focus a little less on vaccines, though right now we are still offering COVID vaccines. So that's another piece of what we offer. And finally, for individuals who are newly diagnosed with HIV or people who have been out of care who are living with HIV and got out of care because of what's been going on this last year and haven't been able to engage in care, or just move newly to San Francisco and need to link back up to care. We're able to provide that bridge care here by offering antiretrovirals and making sure that we're linking them to care with our outstanding benefits navigation team.
Thank you, Jorge. And what about at the center, Hope?
Yes, so thank you. I'd first like to iterate saying that I think one of the most important things is our partnerships. We love our community and those who have the same kind of messages and missions that we do. And so on top of all the services that I'm gonna list off in just a second, I think one of the bigger things too is providing resources from all of our other partnerships, like of course, like the San Francisco AIDS Foundation. It doesn't, because sometimes people are just here to visit, and a lot of the times that they don't even know that there's kind of care and treatment available in their areas. So a lot of the times I do like to highlight that we adore our community and anyone who gets involved. Even just transmitting or disseminating information and kind of like sharing any kind of resources that they have as well. We love that internal monologue with us. I think one of the most important things in our center is in-reach as well. It's important for our team and our staff to understand what the rest of the center offers, so that way we can have proper linkage to care. But as far as what we have here provided, honestly, I don't think that any of our services have changed since the beginning of the pandemic, just as you mentioned. We obviously altered them because we wanted to make sure that we stayed in respect to all the CDC guidelines and stuff like that. But yeah, the only thing that has changed was how we implemented those services. But we still offer things like primary care. Our pharmacy is still open. HIV and STI specialty care, and our pharmacy is actually delivering as well. So we actually do deliveries services, so that way there's no contact if it's the case where that's a better way for them to do it. HIV and STI specialty care, such as testing and treatment, transgender health care, mental health counseling, that's become more digital now, so it's become more accessible for people. Addiction recovery treatment, mentorships and empowerment programs. Again, a lot of these things have been through virtual engagements, social services, legal services, housing, education, advocacy. And I think the most important part is, of course, love and respect and absolute equality for all. I think that's an important service that we provide, and we want to make sure that our community feels that when we're providing all of our other services. So yeah, we do have our message as well, where we kind of try to make sure that people are still maintaining their overall health care. We want to make sure that people do understand the risks and behaviors, the risky sexual behaviors that they're looking for, and also start discussing not only the types of what's going to help them with treatment and anything that's going to help their sexual health, but also discuss with your physician the type of sex that you enjoy having. I think it's so important for us to have that discussion on top of just the treatment and care, because it would suck to be on treatment and care and you're not having the type of sex that you're having. So those kind of messagings, I think, is important for people to come in knowing when they come in to engage with our services. So.
Thank you, Hope. We have a couple of questions from our viewers that I want to get to in a second, but I just want to say thank you to both of you for lifting up partners. Jorge, you lifted up the Oakland LGBT Center and the work that San Francisco AIDS Foundation is doing with them. And Hope, I see behind you, Bienestar, the Black AIDS Institute, the Children's Hospital LA, and Las Memorias, all of which, because I grew up in LA, are near and dear to my heart. So I think it's important to lift up our community partners who we are doing this work in partnership with across our communities. But let's get to our question. So we have a question from Facebook that says, have you seen an increase, this is related to STI, increases in STI cases. Have you seen an increase in STI, sexually transmitted infection cases, since dating apps have become more prevalent in the gay community? Either of you could take that question.
Okay. I definitely want to say yes. It is one of those things. I think I just recently talked to our CETUS program, which is the people who engage people, partners, and anybody who tests as positive. We make sure that we reach out to them. And they were basically saying that cruising has become a thing again, even during the pandemic. And we understand that just like we mentioned at the beginning of the last question, yeah, we don't think that sex has slowed down. It just kind of deviated a little bit. You know, maybe at the beginning when things kind of started with the pandemic, there was a huge pause. But my personal belief, I believe that sexual activity maybe actually increased during the pandemic. This is harking back to just the question that you're asking for the record-setting year of STIs. We really do think that people were getting busy while they were bored, you know, Netflixing and chilling and stuff. So we think that, yeah, it's definitely been a huge contributor to people engaging more on Grindr. And in fact, our team has actually been trying to create profiles to specifically engage people with our services in there, because we know how big of it, we kind of anticipated a big uptake in people engaging in that situation. So we would use geolocation to kind of, because I guess if you buy Grindr, you can kind of access to where you want to geolocate, so you're not just stuck to your region. So we were doing that to places that we knew are populated by LGBT communities, and making sure that we were trying to communicate messaging through them, through education and connection to care and stuff like that, and answering questions that they had on there. So it was definitely something that we saw when it comes to dating apps.
Yeah, and I'll just add, yes, I think there has been some data that supports the increase of STIs, specifically in conjunction with dating apps. I think what's a little bit difficult sometimes to tease out with that data is also we've been testing a lot more individuals with people who are engaging with PrEP and really going in routinely for their testing, you know, every 3 months. Sometimes the question is the rate really increasing, or are we just testing more? And it really is the rate about the same. But I think in general, there is some studies that really do support the idea of increased STI rates with dating apps.
Great, thank you. And the next question comes from Twitch. And the question says, I'm not totally comfortable speaking to my primary care doctor about my STD concerns. Can I come to the center or San Francisco AIDS Foundation, even if I already have a doctor?
I could start with that
Jorge,
question. The answer is yes.
Yeah.
Yes, sorry, yes. So the answer is yes, please. We actually, in fact, many of our clients that we see at Magnet, at the San Francisco AIDS Foundation, actually do have a primary care provider. And that's the reason that they come to see us, is because they've tried to have conversations and just recognize that either the provider just doesn't fit their needs, or maybe just isn't comfortable having the conversation with them. And, you know, kind of to talk a little bit about what we discussed earlier, just really feel stigmatized. Don't really feel like they can ask for you know, the appropriate STI screening. You know, back when I was, I don't want to age myself too much, but when I used to go in for STI testing, and I was offered, you know, a test for gonorrhea and chlamydia, the only thing that I was offered was a pee cup, right? Well, we're not going to find gonorrhea and chlamydia in your throat or in your butt if you don't give somebody a swab to take care of that. And a lot of primary care providers just don't know that. And so, yes, that's the reason why people come to see us. I don't want to speak for the LA LGBT Center, but I'm definitely going to say, please come to us. We are definitely here to have those conversations with you.
Yes, and piggybacking off of what George said, definitely we are exactly the same. We want people to come in here to feel comfortable. We understand that going to primary care sometimes might not be the best environment for them. Sometimes their primary care providers can be a little bit insensitive to, like, their gender or their sexual behaviors. Sometimes we've heard people have a side of kind of medical mistrust because of the fact that they feel that they don't want to be judged when they're talking. Sometimes we even have people coming up to us saying that they don't want to get care because they're afraid that being under their parents' insurance, that they can potentially get outed for going on any kind of treatment or something like that. So we absolutely open our doors to people who are in those situations, and we make sure that we have a very client-centered approach when we talk to anybody that comes into our doors. We want to make sure that we understand what their situation is. Sometimes it's a level of convenience. Sometimes it's the case where their doctor is appointments not for like another 2 or 3 days, and we understand that an exposure to HIV, and you're trying to get on PEP, there's a time limit. You have 72 hours from the time of exposure, and the earlier that you get treatment, the better the chances for the treatment to take effect. So with those situations, we want to make sure that we do have those doors open to anybody and everybody. We are the LGBT center, but it doesn't mean that it's only open for LGBT people. We are open to the entire world, and we want to make sure that we maintain that community-based idea when people come into our doors. So.
Well, that is a great note to end on. Hope, Hatem, Jorge, Roman, thank you so much for joining us today for this edition of TogetheRide In Conversation. It was an awesome, I keep using the word awesome, maybe it's because I'm a child in the 80s, but it was just like such great information. And for folks out there watching and listening, this is what the work that you're doing in TogetheRide, the funds that you're raising, is supporting, so that, as Hope said, anyone can come through the doors of either agency and receive quality, amazing care, whether you're LGBTQ or not. So thank you for joining me today for this In Conversation. And I hope I get to see both of you in person very, very soon. So thank you, everyone, for joining us today for this edition of TogetheRide In Conversation. If you want to get involved and help fund the incredible work that you heard about today, there's no time like now to join TogetheRide. And you can do that by going to TogetheRide.org. We're under 50 days left in the season, and it's not too late to make an impact and help us raise $5 million for San Francisco AIDS Foundation and the Los Angeles LGBT Center. There's a lot to look forward to in June. We'll have TogetheRide Pride. I am so excited to be able to put those two words together. Fun all month long. And our final In Conversation, which will be about COVID-19, HIV, and what comes next on June 16th. So we'll see you right back here June 16th at 1 p.m. Pacific time. Have a great rest of your day. Thanks again for joining us.